So, good day everyone. Good day, Sir Tumlad. We are the Group 3 and now we demonstrating the first aid of the sudden illness, the poison, and the last is the heart attack. So, let's go. Before we start demonstrating the first aid of those three, kasama ko pala dito si Odango and Robles, and the last is Parino. So, what are we waiting for? Let's go!
So, these are the procedures in first aid of fainting. So, the first one is check for other injuries. They may have hurt themselves falling down. So, look for head injuries and any other wounds. Treat as appropriate. The next step is kneel down next to them and raise their legs, supporting their ankles on your shoulders to help blood flow back to the brain. The next step is make sure that they have a plenty of fresh air. If many person around there, ask there to move away. And the fifth is reassure the casualty and help to sit up slowly. If they begin to feel faint again, lie them down again. If the victim is stay unresponsive, please call the emergency hotline number, which is 911. Okay?
911, we have emergency.
So, these are the procedures in first aid of poisoning. There are signs and symptoms in poisoning. The first one is signs of fever with a high temperature. The second is the stomach cramps. The third, diarrhea, vomiting. If you think someone has poison, advise them to lie down and rest. The second is, if they're vomiting, give them small sips of water to drink, as this will help to prevent dehydration. The third, it is even more important to try to replace lost fluids and salts. And the victim is getting to worse. If they get worse and the vomiting and diarrhea is persistent, call for emergency help. So, these are the procedures in first aid of heart attack. So first, we should do to call 999 or emergency number for emergency help straight away and tell them you think someone is having a heart attack. The second step, help move the victim or the casualty into a comfortable position. The best position is on the floor with their knees bent and their head and shoulder supported. Last is keep monitoring the casualty level of response until emergency help arrives. If the victim or the casualty is become unresponsive at any point, prepare to start the CPR until the emergency helps arrives.